Why antibiotics aren't always the best solution for a UTI. If you've ever had a urinary tract infection, chances are you've been prescribed antibiotics. And in many cases, that's exactly the right treatment. Antibiotics have saved millions of lives and remain one of the greatest medical advances ever developed. But here's something that surprises many people. Antibiotics are not always the best answer for every urinary tract infection. In fact, using antibiotics too often can sometimes create even bigger problems in the future. In this video, we'll explain when antibiotics are necessary, when they may not be the best option, and what you can do to help prevent recurrent urinary tract infections. Antibiotics save lives. Let's start with something important. If you have a serious bacterial infection, antibiotics can be life-saving. Kidney infections, complicated urinary tract infections, fever, or infections that spread into the bloodstream should always be treated promptly. This video is not about avoiding antibiotics when they're truly needed. Instead, it's about using them wisely. Not every urinary symptom is a UTI. Many people assume that burning during urination automatically means a urinary tract infection, but that's not always true. Similar symptoms can also be caused by overactive bladder, kidney stones, enlarged prostate, sexually transmitted infections, bladder pain syndrome, irritation from soaps or hygiene products. If antibiotics are taken for a condition that isn't caused by bacteria, they won't solve the problem. That's why confirming the diagnosis is so important. Sometimes your body can clear mild infections. Some uncomplicated urinary tract infections may improve with time, hydration, and close medical observation. Not every patient immediately needs antibiotics. Depending on your symptoms, overall health, and medical history, your healthcare provider may recommend a delayed antibiotic strategy or careful monitoring. This approach is not appropriate for everyone, but in selected patients it may help reduce unnecessary antibiotic use. The problem with taking antibiotics too often. Here's where things become important. Every time you take antibiotics, they don't just kill harmful bacteria. They also affect many of the helpful bacteria living naturally in your body. This can lead to diarrhea, yeast infections, changes in your gut microbiome, side effects from the medication. Most importantly, bacteria can become resistant. Antibiotic resistance. Antibiotic resistance is becoming one of the biggest medical challenges worldwide. When bacteria become resistant, the antibiotics that once worked may no longer be effective. That means future infections can become harder to treat. Some bacteria have become resistant to several different antibiotics, leaving doctors with fewer treatment options. This is one reason why healthcare professionals try to avoid prescribing antibiotics when they are unlikely to help. Why recurrent UTIs become more difficult. People with recurrent urinary tract infections often receive multiple antibiotic treatments over many years. Unfortunately, this creates the perfect environment for resistant bacteria to develop. Eventually, the infection may no longer respond to the usual medications. That's why preventing infections is often just as important as treating them. What can you do instead? Fortunately, antibiotics aren't the only strategy. Depending on the individual patient, prevention may include drinking enough water, emptying the bladder regularly, good genital hygiene, urinating after sexual activity, managing constipation, treating enlarged prostate or bladder, emptying problems, cranberry products in selected patients, vaginal estrogen therapy in postmenopausal women. When appropriate, small lifestyle changes can sometimes dramatically reduce infection frequency. When antibiotics are definitely necessary, there are situations where antibiotics should never be delayed. Seek medical attention if you have fever, chills, flank pain, pregnancy with suspected UTI, kidney infection, severe symptoms, blood poisoning. Symptoms. These situations require prompt medical evaluation. Don't self-prescribe leftover antibiotics. Many people keep leftover antibiotics at home. Then when symptoms appear again, they start taking them without seeing a doctor. This is not a good idea. The symptoms may not even be caused by bacteria. The antibiotic may be the wrong choice, or the bacteria may already be resistant. Whenever possible, treatment should be guided by a urine culture, especially if infections keep coming back. The importance of a urine culture. A urine culture identifies the exact bacteria causing the infection. Even more importantly, it shows which antibiotics are likely to work and which won't. This allows your doctor to choose the most effective treatment while avoiding unnecessary antibiotics. For people with recurrent urinary tract infections, urine cultures are often one of the most valuable tools available. Final thoughts. Antibiotics remain one of the most effective treatments for bacterial urinary tract infections. But they are not always the only answer. Using antibiotics wisely helps protect your own health and helps preserve these life-saving medications for the future. If you have recurrent urinary tract infections, the goal shouldn't simply be taking more antibiotics. The goal should be understanding why the infections keep happening and preventing the next one whenever possible. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more evidence-based urology and men's health content. And remember, the best antibiotic is the one you truly need, not the one you take unnecessarily.